Thank you very much. Well, I'm speaking to you today with my hat as chair of the National Mental Capacity Forum. You will be aware that the Mental Capacity Act went through in 2005, implemented in 2007, just almost exactly 10 years ago to the day. And the Post-Legislative Scrutiny Committee was quite critical of it in terms of how it had been implemented. So I've been employed by Ministry of Justice and Ministry of Health, Department of Health for one day a month to improve the implementation of the Act. I have no budget, no staff and no office, so you can see that it's obviously a very well-resourced task. So I'm relying on all of you to help. So basically, laws send social messages. Banning smoking in public places was a powerful social message. The tobacco companies hate me. But the Mental Capacity Act, the social message, was about empowering people to take the decisions that they can take and get rid of those kind of blanket stigmatising judgments about people's capacity. So I've been working with all sorts of groups, particularly those with learning difficulties, impaired capacity, the finance sector, banks, building societies, utilities, equity release and so on, carers, court of protection, office of the public guardian and everyone, as well as a bit of health and social care lobbed in there just to make me feel comfortable and keep me in my comfort zone. And I have taken some of the illustrations for this talk from the Council for Disabled Children document. They have a fact sheet on the Mental Capacity Act and supported decision making, and I would really commend it to you if you want to read one thing in 15 minutes and just have one resource there on supported decision making. I think it's really a very good one. How many of you can, oh, the lights are gone. Okay, I can still see you. How many of you, raise your hand, could tell me the 5 principles of the Mental Capacity Act? Put your hand up in the air if you can. Surely somebody can. No, nobody can. Okay, fine. That's great. Gives me an opportunity. You're all going to learn it in 2 minutes flat. Nobody gets out of this and I can see you. Okay? Everybody, raise your left hand. Okay? Your pinky. You presume somebody has capacity for that decision at that time unless you can demonstrate that they don't. The bigger the decision, the more capacity they have to have. Okay, that does not include life-ending decisions, though. They're excluded from the Act. The next one, your ring finger. Some people need support to make their own decisions. That's what I'm going to talk about with you. But you can all make unwise decisions. Everybody can and does. Those of you with a wedding ring on may think that was an unwise decision. Talk about it over tea. I don't want to hear about it. But, and go to the pincer movement, if you have to take a decision on behalf of somebody else, it is a best interest decision, which means it is about them, it is not about you, it is about what they need and what their options are, not what suits you, not what suits the NHS, not what suits the budget or the local authority. And you should go for the less restrictive option. You do not keep them under your thumb. The least restrictive option that you can. Okay, I'm going to focus now on the ring finger, despite some of you having a wedding ring on it, which is around supported decision making. And what's the role of supporting decision making? Well, it is to help people plan with their families, with their friends, knowing what's important to them, and using those people around who know about a person to literally support them making their decisions, so that even if they can partly make decisions and some of that decision making is in the best interest category, then you are still using as much as you can of the person's own ability to take a decision. Now, there are 2 other bits of legislation that interact with this. The Children and Family Act, which says that it's full of shoulds, actually. You should support the communicating need and aspirations of children and young people. Local authorities should have staff who are trained and they should ensure there is support available for decision making, and that children and young people feel valued. But they do have a must in there, which I think is important. As well as children and young people being entitled to the same quality and level of information, advice and support as their parents, there is a must, and that they must have confidence that they're receiving confidential and impartial information, advice and support. So it actually puts the young child or young person with learning difficulties, but that may be somebody older who's had a head injury or who's had neurosurgery or who's mentally ill or whatever, but it does put them on an equal footing with those who have capacity in the decision-making arena. And then the Care Act brings in advocacy and so on. But interestingly, P, the person at the centre, must agree that the person proposed is the right person to support them and must feel comfortable with it. It isn't just that you can pull somebody and lob them on and say, right, this is the person who's to support you. And if an independent advocate is appointed, that does not exclude family and friends. They should still be included as much as possible, get as much information about the person as possible, and the local authority has a duty to provide support. And in the Mental Health Act, you can't take decisions on behalf of someone else in intimate and personal relationships, which is around consent to marriage, consenting to sexual relationships. And interestingly, voting in elections, gosh, doesn't that reflect Parliament? Imagine thinking that that is an intimate relationship. I think some people would wish it was all torn up. But there we are. And the action, but it doesn't mean that you can't take action to protect the person who's vulnerable from abuse or exploitation. Now, fine, all that's laid out in legislation, but what do you do in practice? Well, I think the most important thing you do is you listen. I know some of you can read Chinese symbols, but for the rest of you, this means listen, okay? And I think it's the best example because you listen only partly with your ears, but you listen with who you are, with your eyes, but most importantly with your undivided attention and with your heart. You listen from the heart. And the person who is being listened to knows straight away if you're not listening from the heart and if you're not listening with your undivided attention. And you will not get the information that you need to help and support them make a decision unless you listen with those. You don't need your ears as much as you need your eyes and your heart. They're really important. And a good supporter is, people have said, someone who understands my needs, can talk or communicate with me in my way, gives me clear information, is trustworthy, is interested in me and my ambitions, listens to me and has an understanding of my needs. Now, in terms of the 4 steps to assess decision-making capacity and decide how much and looking at where you put the support in, I've said it is that decision at that time. So first of all, is there a disorder of the mind or brain? But importantly, does it interfere with the decision-making? So you, as the person supporting, have to filter out which bits can they take decisions over and which bits of that decision-making process can't they? And can they understand and retain the information? Some bits of information they don't need to retain for very long. Other bits it's very important to be able to retain them for longer in order to plan what lies ahead. But the step that's usually forgotten about is the weighing up of information, and that's where people may need support, because they may well need help to think about the implications for self and others, and they may need that presented in very clear, simple forms. It may be with drawing, it may be using little figures or toys, it may be with gesticulating. You know, it's usually not a pamphlet. In fact, it's almost never a pamphlet. I just wish we'd get rid of information pamphlets across health and social care, because I do think they're a waste of paper most of the time, apart from instructions before you go and have a procedure done. But I'm digressing. It help people weigh up. You know, that's all about personal contact, isn't it? And then, of course, communicating their decision. And if they don't have language or can't speak, then you'll be assessing communication in different ways. And if you have to ask a question and look for a response, remember to ask it the other way around as well, to make sure they're not just saying yes to everything. I've seen so many times people with lack of speech being so-called assessed, and they're just being given loaded leading questions. And then people say, oh yeah, they said yes to that, and they said yes to that, and they said no to that. Well, it's the way the question was presented. You've got to present them back to front as well to see if they're valid. So, for young people preparing for adulthood has got lots of domains around employment, independent living, inclusion, and of course health, and in particular their mental health as well. So if they're going to be actively involved and enabled to participate, there has to be a focus on positive life outcomes. It has to be person-centred and independent as possible, with confidential and impartial information. And that can be really difficult when you've got that elephant in the room of the pound sign and a limited budget. And you have to be honest about what the budget will and won't do. And I think one of the problems is people aren't honest about budgetary restrictions and things that can't be done. And of course then expectations get raised only to be disappointed later. And of course, I said information had to be in an accessible form and readable, and different ways of doing it. And it is only by doing that and putting it all together that you can come up with a plan and help people with decisions and find the right decisions for them. If you want to know more about it all, go to the Social Care Institute of Excellence website. That's me doing the 5 fingers. If you want a revision course, that's why I stuck that one in, just in case you've forgotten. When you send me the names of 100 people that you've taught, I'll give you a House of Lords bar of chocolate. It's expensive and it's quite good chocolate, but I do want people to at least understand what the Mental Capacity Act's about. Thank you.